All right, so when we begin to palpate, there are a few things to keep in mind. We always start with the yin channels, starting with the lung, then pericardium and heart. So I'm right-handed, so I'm starting, my supporting hand is my left hand, and I'm going to cradle the patient's arm. And then with the thumb of the supporting hand, I'm gently pulling the slack out of the skin. So you don't want to squeeze, but just gently hold and then pull the skin towards you. Now with the palpating hand, we need to use the proper part of the thumb. So if you make the OK sign, it's this like top part, the top corner. And then the other thing is thumb placement. So here's the channel, and you want to place your thumb so that it's basically at like a 45-degree angle to the channel. You don't want to be horizontal or vertical, so like 45-degree angle. And then the supporting fingers on the palpating hand are also cradling the arm from underneath. And again, you don't want to squeeze your hand tight, but instead you kind of form like this shape, and then the whole hand moves forward in one motion. So now we have the supporting hand gently holding, pulling the slack out. And the first run is a very shallow run. So we go just kind of like past the skin layer. We're almost like separating that space that we talked about. So again, the light touch is just really barely below the skin surface. We're looking for the space and almost like seeking out where the channel is. The second pass will be at the middle level. So now you're trying to get in between the muscle space and going all the way up to the Hasi point. And then the deep level is deeper, so kind of almost like down to like just, you know, bone level. Oh, you have some nice nodules in there. So one thing, again, if you're watching me, I'm not stopping. So even though I found something here, I'm not stopping just yet. I want to use the smooth pass for those 3 levels, because if you stop and start too much, you'll miss information in the channel. So in a clinical setting, you know, because I found some interesting things, then I go back and I investigate, like, and I can ask questions, you know, like, do you have a history of asthma, bronchitis? You know, I'm just making stuff up, yeah. But it will help you guide your sort of path of questioning. So that's the lung channel. And then we move on to the PC. So we, again, kind of like cradle, and then my thumb moves over to the pericardium line and pulls the slack out of the channel. And again, this corner of the thumb, and starting at, on the yin channels, we start at the source points. So starting here, the gentle pass up to the Hasi, and then medium, and then deeper. Okay, and then the heart channel. So again, moving the thumb over so you're on that channel. And one thing I'll say about the heart channel is that most of the active points on the channel are in the lower part of the arm. So, you know, we have the source point, chi cleft point, lower collateral point. They're all in the lower part. So the heart changes are often mostly in this area. And because the heart channel is small, because of the anatomy, the changes are also small. So you see me kind of like going rather quickly, but, you know, again, clinically, if I am like palpating more carefully, I will go over this section more slowly. And the changes here are a little bit smaller. And when you first begin practicing this palpation, you might miss these things, but don't worry about it. You'll develop more sensitivity as you continue. So even though you don't know what you're palpating, just keep doing it, because eventually the information that you feel starts matching up with your symptoms, and it will start to help you understand the physiology. So we finished the yin channel, and okay. So now we're on the yang channels, and on the yang channels, we start palpating at the shoestring points. And so for the large intestine, we're holding the arm like this so that we can keep the channel open. And remember, again, not to squeeze the hand together. I'm just supporting her hand and then using my thumb to pull some slack out of the skin. So I'm focusing on this area between LI3 and LI4. using the anatomy of the channel to help me as a background. So I'm using the side of the index finger bone, metacarpal, as the backdrop for any channel changes that might be there. So after I investigate here, I'm going to move my support hand up to the main part of the channel. And again, taking some slack out of the channel. I'm starting at LI5. And then this is the first pass, just below the skin level. A little bit deeper. Now Kai is tall, so her arm, like I'm, but like small. So I don't know if you can tell, like sometimes like around the middle of the channel, if someone has a long limb, the skin starts to move. So I'm going to keep the pressure very steady, but I'm moving my support hand just to pull the slack out, and then I continue palpating. Because when the skin starts moving too much, then you also lose information. So that's just something to keep in mind. Another thing for the large intestine channel, just to note, in this area of the channel, there's a lot of sort of anatomical crossings. So there are, ligaments that are kind of like wrapping over to your fingers. So when you first start palpating here, you might think like, oh my gosh, there's like lots of changes here, but get used to what the anatomy feels like, because like everyone has like this tendon that like wraps over. So it's kind of like you get over that tendon and then there's changes just past it. The next one is the Sanjiao channel. So again, we're going to turn the channel just a little bit more. So now the radius and ulna are parallel, and we start at Sanjiao 3. So again, just gently hold the hand and then pull the channel tight. So we're just going to focus in this area in the triangle between the 4th and 5th metacarpals. And here, because we have two bones kind of framing the channel, we can use both sides to act as the backdrop. So once I check on the 4th metacarpal, then I can go over to the 5th and just see if there's any changes there. Once I investigate that, again, I'm moving up to the wrist and then supporting the channel, pulling the slack, and then I go up the rest of the channel. And the changes on the Sanjiao channel are usually pretty obvious. So yours is nice and smooth. And so we do the 3 passes there, and then we go to the small intestine channel. So this one looks a little awkward, but you want to make sure you keep the patient's arm as neutral as possible. And you're, again, supporting the hand. And here, I can't really pull the slack with my thumb comfortably. So I'm kind of just like gently holding her hand this way and just stretching the skin a little bit. So again, focusing on the area between SI3, SI4. And again, we have a bone here. So we're really between the bone and the muscle and investigating what that space feels like. We have a little something here. And always check in with your patient also, because usually if you find something, they will feel a little bit of tenderness or soreness. So if it's too painful, I will also pull back because I already have the information I need. So going back, so we finished with SI3 to SI4 and then moving up to the wrist. And then we're really staying along the edge of the bone here. And the small intestine channel is similar to the heart, where there is less significant information in the upper part of the channel. I would say the majority of information would be between SI3 to like SI6. So that would be all of the arm channels. And then what I do in my clinic is then I have my patient lie down and I palpate the leg channels. You can also do it like if I had a stool, I could have her, put her leg on my my lap and palpate that way. Dr. Wong used to sit across from the patient, in 2 chairs and then put their leg on his lap and palpate. But I find it easier on a table. So if you don't mind lying back. Okay, so then we go on to the leg channels. And again, we're starting on the yin channels. And we start with the spleen, liver, and kidney. So for the spleen channel, again, you can't really hold the channel tight with your thumb comfortably. So I like to just like gently hold the foot and then just kind of pull a little bit towards me. So here between spleen 3 and spleen 4, we're again focusing just on that small space between the bone and the muscle. And doing 3 passes. So what I do here is I try to do 3 passes in the space, and then I also, again, kind of like just change my angle a little bit and use the bone of the first metatarsal here, or the side of the first metatarsal, as a backdrop. So there's some tightness in this channel. So this is also diagnostic. When the space feels tight, like it doesn't want to let you in, that's also telling you something. So sometimes in this kind of situation, if I press too much, it might be too painful for the patient. So I'm watching her face. She's giving me a thumbs up, so we're good. So after you investigate spleen 3 to spleen 4, then we move up. And again, on the leg, you might be using sort of like different parts of your thumb to hold the channel. So I kind of, you can even use like the whole hand to kind of just support the skin. And again, you don't want to press down, but pull towards you instead. So starting around the malleolus, you're following the back of the tibia all the way up the spleen channel. That's the first pass. Second pass. It's okay. So I'm feeling some nodules, so I'm just checking in with Kai and just to make sure it's not too tender. So again, I felt some things. In a clinical situation, I would go back and investigate and maybe ask more questions based on what I'm feeling. Moving on to the liver channel. Is this side better?
Oh yeah, maybe
yeah.
Side's better.
Okay.
Experiment.
Okay, so with the liver channel, the way to stretch up this part of the skin is just to bend the toes towards you, and again, gently. So you don't want to really wrench their toes, but just enough to pull the skin tight. And again, you're investigating that space between the first and second metatarsals. So first, and starting here, actually, you're starting at the yin spring point. So first investigating the space in the middle. And then using the side of the first metatarsal as a backdrop, and then switching angles again to get to the side of the second metatarsal. Ooh, there's some good stuff in there. And this is an interesting space because it seems like it would be very small, but actually there's like often lots of different changes, different textures, and you can gain a lot of information here. After you finish investigating here, then you're moving up the liver channel. And so here, can I turn just a little? Is that okay?
Yeah.
So here, just to explain Dr. Wong's method of looking for the liver channel. So for instance, like liver 5, for decades he used, that half on, half off sort of location for liver 5. But as he palpated more, he realized, using that theory of like the channels really being in the spaces, he realized that, if he really followed the space, the liver channel actually ducked behind the spleen channel at a lower place than what the textbooks say. So the textbooks say that the channels cross, I think it's like 9 sun up or something. Forgive me if I'm wrong about that. But he will say that the channel actually crosses a little bit lower. So starting at like liver 4 area, you're kind of like along the edge of the bone. And right here in the tibia, there's actually a little notch that will then direct your finger just back behind the spleen channel. And then if you follow that all the way up, you'll get to liver 8. Actually, let me do it on this side. So maybe I'll start with like this, the foot part.
From the liver 5.
Okay. So, so again, like instead of the liver 5 being half on, half off the bone, Dr. Wong actually noticed that if he really followed the space here, the channel was behind the spleen channel. So again, here I'm using the support, like my whole hand as support for the channel. And then I'm following the space. And if I really let my thumb do the, searching for the channel instead of what I think in my head, textbook wise, this will actually lead me to what Dr. Wong used as liver 8. So I know there's a lot of controversy, is it above or below the knee, but for him, it was here, and it would exist just in front of kidney 10. So when you're looking for kidney 10, you're finding the space between the semimembranosus and semitendinosus. And then, so that would be kidney 10, and then liver 8 falls just in front of that tendon. So then we move on to the kidney channel. For the kidney channel, we also start kind of like around kidney 2, actually. So again, supporting the channel. And then the first pass we're going to do is kidney 2 past kidney 6 to kidney 5. A note here also that Dr. Wong's location for kidney 6 is below the textbook definition. So you go below the malleolus and there's a nice space there, and there's like 2 ligaments that come down, so it's in that, that space. So again, supporting the kidney channel, starting at kidney 2 and doing a pass forward. And then as an addition, kidney 5, for palpation purposes, he would also sort of like consider it sort of this whole heel area. So after I do this initial pass, then I also investigate kidney 5 and I kind of swipe it in 3 moves. And then after you're done with kidney 5, then you change your position. So now you're at kidney 3. And again, kind of using the hand as support, starting at kidney 3. Some changes here. So, one thing just to keep in mind, really let your thumb find that space for you, because as you're doing it, I think because the channel's long, I think our brain tends to be like, I think spleen 8 is supposed to be here, and you start to direct your thumb. So kind of turn that off. Dr. Wong would even close his eyes sometimes or look away. Like really let your thumb guide you, because when you find the channels this way and when you locate the points within those spaces, your needling will be different, and then you'll really get to learn the points in a different way. So that wraps up the leg yin channel. So then we move on to the yang channels. I'll move back over here. So for the stomach channel, we're again going to pull the toes gently towards us, starting at stomach 44. We're investigating the space between the 2nd and 3rd metatarsals. So 3 passes down the center, and then I'm just changing the angle a little bit so that I'm getting the side of the bone and then moving over to the other side as well. There's some tightness there. Okay, so after that, I move up to stomach 41, and again, using my whole hand to kind of pull the slack out, and then I'm finding the stomach channel. Just to note here, Dr. Wong's location for stomach channels also may be different from the textbook, so he doesn't do any measurements with his fingers, but instead the channel exists in the lateral border of the tibialis anterior muscle. So in some cases, if you're not sure, sometimes the muscle can be really tight. So what I do is I actually kind of come up to the top of the channel where the muscle is more distinct. So even before I start palpating, if I just want to double check where that space is, I'll start up here. And so then I can do the actual palpation in one swoop. Some nodules in here too. So again, just making notes in my head, and I go back and pull it all together into the puzzle of the diagnosis. So yeah, really try to play with this, because I don't know about you, but sometimes needling, if you use the finger as a measurement, you end up in the belly muscle, and it actually feels terrible, and you don't get good chi sensation. So if you play around with it and really let the points exist in this space, you'll get really great needle duchy. So that's the stomach channel, and then we move on to the gallbladder channel. So again, kind of just gently pulling the toes towards me. So here I'm investigating the whole space between the 4th and 5th metatarsals. There is that tendon that runs through it, so just check that first triangle first. And then you can check behind the tendon also. And then moving up the channel, so like around gallbladder 40, again, using my whole hand to support the channel. And then going up that front of the tibia. Okay. And then lastly, we have the bladder channel. So here, again, don't squeeze the foot, but just kind of gently support the skin. And you're starting at 65. And then going past 62. Here, again, based on like, whether it's like, your anatomy or the patient's anatomy, you will get kind of ambidextrous with the technique. So here you can see I'm kind of turning too much. So if I'm uncomfortable, I'll switch to my other hand. But I'm doing the same thing. I'm supporting the skin using this top corner of my thumb. And then just to note also that UB62, similarly to kidney 6, Dr. Wong located below the textbook definition. And there's a really nice space here. And then moving up the rest of the channel, what I do when the patient is face up is I just go as far as I can go. So like up to UB58. And you can, definitely feel something there. And then in a first visit, I'll have the patient turn over and check, you can check like UB40, and then you can also palpate the dew channel. But at least like with the arms and legs, this is a good place to start. And, all this information will help you understand like the physiology, the pathophysiology, and help you choose a more clear diagnosis.